Welcome to the Autism in Black podcast, where we focus on all things autism and the Black parent experience. Our goal is to always educate, support, and empower parents to advocate for not only their children, but themselves. Hello, and welcome to the Autism in Black podcast. I'm Maria Davis-Pierre, a licensed mental health counselor in the state of Florida and America's #1 autism advocate for Black parents. I'm the founder and CEO of Autism in Black, Inc., where we aim to include the excluded. Today, we have Dr. Brandy Tanner. Dr. Brandy Tanner has over 20 years of experience working with children and adolescents with learning disabilities and behavioral concerns. She is both a licensed psychologist and a certified school psychologist. Currently, Dr. Tanner conducts comprehensive psychological and psychoeducational evaluations in her private practice, Lightway Psychological Services. She provides special education advocacy services, consultation, and training through your IEP source. Dr. Tanner is also a speaker at the 3rd Annual Autism in Black Conference, and today she is sharing a little insight into what she will be speaking on and what her workshop is about at the 3rd Annual Autism in Black Conference. She will be talking about comprehensive evaluations within the school system, how to make sure that your child is not being miscategorized, the difference between a medical diagnosis and a school diagnosis, what happens when your child is miscategorized and how that can impact the services, interventions, modifications, and accommodations that your child is receiving. So Dr. Tanner and I had a great conversation about how you can make sure your child is getting what they need through comprehensive evaluations within the school system. And as always, if you are interested in attending the 3rd Annual Autism in Black virtual conference happening April 28th through the 30th, make sure to click the link in the show notes and secure your ticket today. Enjoy today's episode. Hi, everyone, and welcome to another episode of the Autism in Black podcast. We have another very special guest here. We have Dr. Brandy Tanner, who is one of the 3rd Annual Autism in Black virtual conference speakers. So I'm excited to have you here, Dr. Tanner.
I'm excited to be here. Thanks for having me. I am excited about this interview and also about the upcoming conference.
Thank you. So I have already read your wonderful bio to our listeners, but can you tell us more about yourself?
Sure. The bio that usually goes out when I am going to be doing a presentation or some kind of professional work, it highlights a lot of the academic things about myself. As far as the autism community goes, my brother has autism. So back in the 80s when we were kids, autism diagnosis didn't happen as quickly and easily as it does now. So, in addition to having that academic perspective, I also have a personal perspective through my family. So, that's an important thing that doesn't always get shared. And I think it's going to be important for the listeners of this episode to know. Also, just to kind of piggyback on the academic side of things, I used to be a special education teacher, a school psychologist, and over time, I wanted to work more directly with families instead of working, quote unquote, for the man or for the system. So I've shifted out into private practice work and into advocacy work specifically so that I can really dig in and help families get the services and the help that they need.
Oh, that brings up a question for me. So, with you branching out and doing the private practice work, as you all know, I'm a clinician as well, so this is intriguing to me. With you branching out and getting your own private practice, do you now do independent evaluations for students so their families can take those evaluations to the schools when they're challenging the categorization and the evaluations that are being done by their actual school?
I do. Right now, my psychology practice is very small, and that is because the advocacy side of things has been growing. Um, I have a really small caseload of evaluation clients, and it usually is situations where somebody needs an IEE. It's a tricky case, and it's a personal referral from another professional that I know that needs a really good, clean evaluation. So, um, not kind of out to the masses, but I do like continue to do a few evaluations, but mainly I've been leaning more into the advocacy side of things as of late.
Perfect. I love that. So I want to get into just giving our listeners just a little bit of information on what you will be speaking on at the Autism in Black conference. Don't want to give them too much because you guys got to get your tickets to be able to hear all of the goodness. But can you give us a little bit of information on what you will be talking about at the Autism in Black conference?
Sure. I am going to be doing a presentation that deals specifically with autism diagnosis. And a few of the highlights or key points that I'm going to be going through are what are some of the reasons that somebody would want to have an evaluation or, possibly seek a diagnosis if they suspect that their child or their loved one has autism spectrum disorder. I'm also going to be talking about the ways that you would vet or seek a private professional to do that evaluation, considerations for if you choose to have the school or an agency do the evaluation. And then for people that have kids that are school age, if you want to take the information from your evaluation or diagnosis and seek school services through special education, a little bit about how to do that and that side of the process.
Perfect. And these are all extremely important things. And I'm so honored to have you as a speaker because we have had clinical psychologists on our show before and have spoke at the conference before, but you are actually both a licensed psychologist and a certified school psychologist. So you have a unique perspective that I appreciate. And one of the things that I did want to highlight, because we talk about it all the time, is there's a difference between a medical diagnosis and a school categorization. Can you kind of expand on that a little more for the listeners?
Yes, if you are seeking an evaluation from a private provider, such as a clinical psychologist, a medical doctor, a developmental pediatrician, those individuals are going to be giving you a medical diagnosis of autism spectrum disorder. If the child, whoever it is that's having that evaluation, meets the criteria. On the school side of things, they are going to be going through their criteria to see if that student meets eligibility for special education services under the category of autism. So sometimes those things line up and overlap nicely. And unfortunately, that is not the case in every single situation. Private providers, particularly, like, I'm going to speak from the side of being a licensed psychologist and doing those types of evaluations in my private practice. We are using the Diagnostic and Statistical Manual, 5th edition, the DSM-5. We're going through those criteria to see if the individual meets the diagnostic criteria for an autism diagnosis. So we've got two categories of symptoms, and we're seeing, are we meeting those criteria based on the DSM-5? On the school side of things, they have their own criteria. In my state of Georgia, where I live, we don't have those two categories with 3 to 4 symptoms each. We have a list of 5 different things. So, as I said just a few seconds ago, sometimes they line up nicely and sometimes they don't. You can see, like 2 categories, 5 criteria, they don't line up nicely here. So, if you're getting an evaluation on the school side, that may not automatically translate into a medical diagnosis. And then to kind of take that a step further, a medical diagnosis that can potentially help you get access to certain types of intervention services that you may be interested in. It may potentially get you access to community services, eligibility for aid programs and things like that, whereas a school evaluation may not, because that's educational autism, as opposed to a medical diagnosis of autism. So if somebody is just starting out on this journey and wondering where should they go first, those are some of the considerations to keep in mind. Or if it's somebody that is getting an updated evaluation and they're trying to figure out, do they want a school route or a private route? Those are some things to kind of keep in mind as far as where can a medical diagnosis take you and where can a school evaluation with their criteria take you.
Perfect. You brought up a great point, and actually, it's something that me and my family have dealt with. My son, when he first started school and was getting evaluated, he ended up getting the developmental delay category, mostly because his sensory seeking and the ability to not quite sit for long periods of times, and just being young, his evaluations were not coming back. I forget the word, but they were not coming back to where we could actually trust the categorization. So we did wait until the developmental delay drop off time period, which here in Florida is 6. And at that time, they started the reevaluation process. And at that time, we were also on a wait list for our developmental pediatrician. Here in South Florida, we have one in our area. So there was quite a wait list for that. And he actually has a medical diagnosis of autism and ADHD, but he does not have a school categorization of autism because he does not meet the criteria. And that is something that has been back and forth with the school. At this time, he doesn't even have a OHI category. He only has a speech impairment categorization on his IEP. However, because of working with my attorney and being involved in advocacy and having great teachers that he has, we have made sure that his IEP covers everything else, but it is such a struggle of getting the correct categorizations on his IEP.
Yeah, I see a lot of wacky situations where, like a child may have a very clear medical diagnosis of autism spectrum disorder. They've checked all the boxes for that clinical diagnosis. On the surface, you can see the symptoms and how they're affecting that student at school. And for some reason, the school chooses not to classify them under that. I recently worked with a family where, like I said, ticked all the boxes, got to the school side of things, brought in their private evaluation. And when the school reviewed it, their speech therapist said, this child scored in the average range on all our tests. There's no speech problem here. So we're going to not find her eligible for speech. And therefore, since there's no speech difficulties, we're not going to find her eligible under autism spectrum disorder. And I was like, what about the pragmatic language aspects of speech? Because if this child is, running away, screaming, and not able to play with other kids on the playground, there's obviously some sort of a communication difficulty that she's having, that she needs to improve her skills with getting along with others and being able to communicate effectively. But yeah, lots of wacky situations come through. Some kids that should be qualified under autism are not, and there are also some kids that are being qualified under autism when it's actually something else. There's a lot of misdiagnosis both ways, both over identification and under identification, from those individuals that aren't necessarily specially trained to do those types of assessments.
Exactly. And that is another great point that you bring up, is a lot of individuals who are not qualified to do these assessments who are doing them, and it's leading to misdiagnosis within the school system. We'll talk about outside of the school system in a minute, because we know misdiagnosis is just running rampant for Black children in the Black community. But within the school, we have a lot of individuals who are not qualified, especially now because of all of these shortages that are happening, that were really big before COVID, but after COVID, and we're still in COVID, it's gotten even worse. What are some of the things you're seeing in regards to individuals who are not qualified doing these types of assessments?
I think the best way to tackle that is I'm going to kind of walk through what my own training was like, and then the training of the other people that were my colleagues when I worked in a school setting. I did a specialized internship that was at an autism clinic where I got special training in autism evaluation, diagnosis, autism interventions. So that was a year-long placement where I got very intense, heavy exposure into how to administer those autism specific instruments, such as the ADOS, and how to, like clearly identify, like this is autism, this is not, this is something else that, looks similar, but it's actually a different type of condition that we should treat in a different way. So I had a full year immersed in it. And that's how I got my training. And that's kind of where I really cut my chops and gained my confidence with doing those types of assessments. When I went to work in a public school setting, it was kind of like if they're in your school and they're on the list for testing, you're going to test them. So you kind of were requested to be a jack of all trades, regardless of if that was your specialty area or not. So, there are some districts that do a little bit better. They might have an autism team, or if we suspect ASD, like we're going to call in some of the people that have a higher level of training in that area, but not all districts operate in that way. So, on my staff, which was, like a fairly large staff of psychologists for people in our area, we would kind of get together, like collaborate on cases, give help to the other people. But I remember thinking to myself, I would worry about those students knowing that the person that was doing the assessment was having to go to somebody else to find out what to do because they were unsure of it. So it really made me feel like those students were not getting the best quality evaluations that they possibly could. And the possible ramifications of that would be, like perhaps they're misclassified, perhaps we miss something that we should be having for their treatment plan, for their IEP plan. So, when we're doing assessments, part of it is, like, let's identify what's going on. A lot of people don't want their kids labeled, but if it's going to get them access to services, and also if it's going to let us know specifically what's going on so that we can dive in and know what interventions are going to help that student, that is the reason that we want to do the assessment. The other main reason is for treatment planning purposes. We want to appropriately identify what's going on so that we can do the right interventions to help that student. So if we've said that it's not autism, it's emotional behavioral disorder, we might be missing out on a whole array of services that we could be providing to that student to help them because we made a plan that's going to treat the wrong thing. So, it's kind of, I'm sorry, I just kind of went like onto a dovetail with all of that kind of stuff, but that's kind of where it goes to. If you don't get a good quality evaluation, you might not get the right label, and then you might not get the right services, and you're really doing a disservice to that student.
Yes, and this is really important because you brought up the actual categorization that triggers me. The emotional behavior disturbed category. And as a fellow clinician, you know that this is not even a actual diagnosis in the DSM. It's just for me, my personal feelings about that category, especially in regards to Black children, is that there are not a lot of culturally responsive clinicians that understand culture comes into the room with their clients, with their students. And because our characteristics can be so vastly different from what is in the DSM, a lot of children are misdiagnosed. And in the school system, Black children are placed in that category at a high rate.
That's correct, and also it's very unfortunate. When I'm consulting with parents, I often am telling them, If there's another category that we can look at outside of that emotional behavioral disorder EBD category, let's see if we can qualify under something else. Because having spent the better part of a decade working in a school system, receive a new file, receive new paperwork on a student, open it up on the first page, see emotional behavioral disorder or EBD as the classification, um, that your mind just kind of goes to, okay, this is a problem student, this is a bad student, this student is going to give me a lot of problems. And so just having that anywhere on the student's paperwork just kind of conjures up a negative image when somebody might not have even met the student first. Also, to your point a few minutes ago, that's not even a diagnosis that's in the DSM. So, on the school side of things, it seems to just be kind of a catch-all for students that are having emotional or behavioral difficulties, but it doesn't really give you clear information about how to help that student. If we know that that student is having difficulty because like they have a trauma background, we're going to work with that student in a certain way. If we know that their difficulties are rooted in anxiety, we're going to use a different set of strategies or interventions to help that student. If we know it's based in depression, we're going to use yet a different set of interventions to help that. So just having that catch-all category that tends to be labeled as, like these are the bad students, doesn't, first of all, it doesn't really capture what's going on with the student. It doesn't give us information that we need to be able to help that student. And then also over the years, in my opinion, it's come to just be kind of like a bad connotation of students that have that classification. Just from jump, when people see that, they usually have bad thoughts, and it just sets that student up for failure because there's a low expectation.
Exactly, exactly. And can you walk us through some of the differences if a student was miscategorized and given a EBD category instead of an autism category? What would be the difference in that IEP as far as services that they're getting, or some of the goals that may be missing?
Um, for a student that is autistic, we're looking at goals that have to do with what are those criteria that have to do with an autism spectrum disorder diagnosis. So part of that is probably related to social skills and language and communication. So for a student that has autism as their eligibility, they're probably going to have goals, objectives, accommodations, and services that are related to things like let's build your social skills, let's improve your communication, things like that. A student with an autism category, they probably will at least have some recognition that there's a possibility of some sensory processing things that are going on. So that will probably cue them into let's get the OT on board and see if they have any ideas for sensory strategies. Like, does this student need heavy work? Do they need noise canceling headphones? Things like that. Those things would probably be introduced into the team, the plan for that student. Also, the way that we work with that student, because they could potentially have, some ritualized or black and white type of thinking. We may work with that student around, let's give you some prompts around, like, let's give you some transition warnings. This class is going to be over in 5 minutes. Let's start to wrap up. So, there's probably going to be some specialized interventions related to ASD that are going to be at least put on the table and considered for that student's plan, specific to, we know that you have autism, we know that these are the types of things that you potentially have skill deficits in. Let's help you build up those skills. If somebody was to write a good IEP that was um, for an autism spectrum disorder student. On the flip side of that, if we've identified a student as EBD, we might not dive into all those things. They're probably not going to bring up sensory issues. They're probably not going to bring up, language and communication issues. They're probably just going to kind of hone in on, like, how can we like decrease these problem behaviors, and that's it. When there's probably, like more at the root of it, where they could actually make a good plan to help that student, but they missed so many pieces where they could potentially intervene and help that student with their skill deficits. Instead, they're just kind of zeroing in on the behavior. So they've missed a lot of opportunity for intervention and help for that student if they misclassify them as EBD instead of autism.
Yes, thank you for really setting the stage on how those two IEPs can look completely different. And this is what I'm talking about, everyone who's listening, that this is such, you know, one, it just upsets me because the trajectory that that child can then go on when they are miscategorized, especially our Black children, it's heartbreaking because it can be school to prison pipeline when you are looking at the child as a problem behavior, when people are already having their biases on this child because of what they're seeing on their IEP, because of the child's skin color. All of those factors are coming into play, and that child is not being seen, heard, treated with respect, making sure they're getting appropriate accommodations, services, and all of that, and kind of left to their own devices in a sense of what they're doing. And they're not really getting what they need academically in the school. And it really just leads to school to prison pipeline, in my opinion. And I think that that is something that just breaks my heart because I know that mostly we're looking at Black students when we're talking about this. So that's just my personal feelings on that matter.
Yeah,
um,
I'm totally in agreement with you on that.
good, good. So is there anything else you wanted to highlight at this point in the podcast before we wrap up? We've talked about so many things. Um, that I'm just sitting here thinking and in awe and just really ready for your session at the conference to watch that. So I'm excited. But is there anything that we didn't touch on that you really want our listeners to know and understand?
Yeah, coming from the perspective of, like I said at the beginning, back in the 1980s, people were not diagnosed with autism like they are now. And so witnessing, like my own brother being misclassified for years and years and years completely, all the way up into adulthood,
Mm.
it really brings home the idea that we need to really clearly identify what's going on so that you can get access to services and programs that you're potentially eligible for, and also so that we can know the right interventions, treatments, services, supports, things like that that could be helpful to you. Because like combining all of that onto like months, years, a lifetime of you missed out on, like services, accommodations, supports, like that could be a really negative impact over a long, long time. When we are looking at doing an evaluation, we want to think about, do we have a good quality evaluator? Are we going to have a medical diagnosis if that's what we need on the school side of things? Are they putting my child in the correct eligibility category so they'll get the services that they need? So I know a lot of people, this is my own personal pet peeve, as a person that writes 20-page psychological evaluations, like a lot of people just want to look at a psych eval, check off their checklist and say, yeah, we've got one in the folder, but there's really a lot more to it. Like I said, it can unlock all of those other things. So I hope that people that are listening kind of realize like this is a really important piece of the puzzle, and to make sure that we do it clearly and correctly.
Yes, I agree with that. There are so many instances, especially now for our listeners, understand that a lot of districts are short staffed when it comes to school psychologists. I think our school psychologist services, there's two that service the entire district for us. And there are, I mean, the reason I had to get an attorney on board was because of the actual lateness of reevaluation for my daughter, and how they just seem to really not care. And I'm like, she's a completely different person at this point. We need a new complete eval so that we can make sure that she is getting what she needs. At the time of her first eval, she was non-vocal. she is now verbalizing things. We need to make sure that we are keeping up with her progress. So it is super important to make sure that we are, one, getting quality evals and making sure that they're done in the manner that they need to be done in. So thank you for bringing up that point.
You're welcome. Like I said, I just, both from a personal perspective and a professional perspective, I just can't emphasize the importance of that enough.
Yes. And as somebody who also has got diagnosed last year at 38, but in the school was considered gifted and in the gifted program, I really could have used a lot of supports in school. And I see how that has really impacted me, has, increased my anxiety around certain things because of not getting the supports that I needed in school. So even for those who you would consider not needing supports, just because you're not seeing it externally doesn't mean that internally things are not happening.
That's right. That is very much the case. And like when I talk to autistic adults and learn about their experiences, I'm really glad that we're getting better at early identification so we can get those supports in place for people sooner so that they don't have difficulties.
Thank you. So as we wrap up, is there one thing that you want to leave the listeners with?
Yeah, like I said, I just really like to focus on making sure that everybody's getting good quality evaluations and good quality services. I do provide advocacy services at your IEP source. Like we mentioned at the top of the podcast, I do have a small caseload of evaluation students through my private psychology practice. I do provide a lot of information and tips online. My website is youriepsource.com, and I'm also on Facebook and Instagram, both of those at Your IEP Source.
Perfect. And we will have all of those links in our show notes, as well as information on how to get a free guide from you on how to get an IEP and the overview of the special education process. So that link will also be in our show notes. And you can also catch Dr. Tanner at the 3rd Annual Autism in Black Virtual Conference happening April 28th through the 30th. So thank you so much, Dr. Tanner, for being on the podcast as well as being a speaker for us at our conference.
You're welcome. I'm very happy to participate.
Thank you. And thank you all for listening to another episode of the Autism in Black podcast. And we'll see you on the next episode. If you haven't done so, make sure to subscribe to our podcast so you can always be notified when a new episode drops. To get the resources shared on today's podcast and the show notes, make sure to go to autisminblack.org/podcast. And be sure to share your takeaways from the show on IG stories and Twitter using our official hashtag AIBPod so that we can find them and share them. And if you want to continue the conversation from today's episode, make sure to join our Autism in Black podcast Facebook community. And please make sure to answer the questions to gain entry. Thank you for listening and joining me this week. Have a good one.